All right. Hello, everyone. I am Dr. Brandon VanderWel. I'm one of the bariatric surgeons here at Eviva. And today we are doing an Eviva podcast. This is our second ever with patients, and I'm really excited. We're talking about laparoscopic sleeve gastrectomy today, otherwise known as the lap sleeve, the LSG, the sleeve gastrectomy. And yeah, we have some great patients who are several years out, and we have Dr. Robert Landerholm and Nora, our dietitian. And I'll let everybody introduce themselves. But yeah, we're really excited to have you check it out and hear some of the experience about what it's like with these tools of surgical weight loss. So, as I said before, Dr. VanderWel, one of the surgeons here, been here at Eviva for 4 years. Love it here. It's been great. And yeah, take it away. Nora, you want to go next?
Sure. Hi, everyone. My name is Nora. I'm one of the dietitians here at Eviva. Been with Eviva 2 years now, and I'm loving every second of it. It's home. I love our patients. I love the team I work with, and it's a rewarding job seeing people's life change every day, and improving the quality of life. It's really exciting to see that every day.
And do our patient guests want to go next?
Sure. I'm Tina, and I had the sleeve surgery 6 years ago with Eviva, and I've been super happy with everybody that I had come in contact with was just so professional and helpful, and it's just been a wonderful experience for me.
Want me to go next?
Go for it, Lisa.
Okay, I can't find you guys, so I'm talking blind. Oh, there you are.
There we are.
Where did it go? I'm Lisa. I am 3+ years out now from the gastric sleeve surgery. I'm also 2 months out from post tummy tuck muscle repair and micro lipo, I guess. So yeah, I'm feeling really good. I've sent a lot of people to Eviva, so I obviously love you guys.
Thank you, Lisa. It's great to see you. Dr. Landerholm here, compadre with Dr. VanderWel, of the two surgeons at Eviva, and working for years with Nora. Nora, it's great to do another podcast with you. It's been a while. So
It's been a while, yeah.
It has been a while, yeah. So absolutely love what we do. Fantastic team. For anybody watching this who's considering coming to see us, we're very relational. Our philosophy is we want to take care of people, take care of patients the way we'd like to be taken care of.
Yeah.
So yeah, everybody wins here. So glad you're with us.
Cool. All right. Well, thanks for joining us, everybody. I will share my screen here. All right. Can you guys all see my presentation?
Mm-hmm.
Yes.
Yeah.
Excellent. All right. Just like I said, here's our team today. All right. Laparoscopic sleeve gastrectomy. What is it? So it is laparoscopic surgery, which is what this first picture is, which is tiny incisions along the abdomen. And then you actually use carbon dioxide gas, which is very well tolerated. It's very well easily absorbed, to kind of blow the abdomen up. It's almost like the abdomen's pregnant, the abdominal cavity. And then you have a lot of space to operate and do all sorts of types of surgeries in there. One of which is the sleeve gastrectomy, which you can see occurring in this picture. We use cameras and very small, thin instruments to then make the stomach much smaller. It goes from this big bag, this big reserve organ, down to a small tube. I call this small tube sleeve-shaped stomach our 21st century stomach. Honestly, in the 21st century, we really don't need stomachs this big. This is one of my weird things I believe, but I believe 90% of the population could honestly be just fine with a sleeve gastrectomy, like in the 21st century. When we have refrigerators in Costco, we're going to be just fine. So you can see another picture here. This is what the sleeve kind of changes into, is this, large, it was this large bag, and you take this part off with the stapler. So I actually have a little stapler here, show and tell time. So this is a stapler device. It's very expensive. It's very nice. It works really good. And it takes the stomach and you clamp down on it. You can see all the little holes in there. And there's all these little staples that are titanium at 2 to 3 millimeters in size. And that seals the tissue and also keeps it really clean, and and then it cuts in between it. And then you can just march up the stomach like you see in that one picture. And it's a very clean, a very precise way to do an operation. So the stomach is very well sealed. It never is open and having stuff coming out of it or anything like that. It's a beautiful thing. I mean, people ask me sometimes, do I get sick of doing sleeves? It's like, do you think Tom Brady ever got sick of throwing touchdowns? No. Like, yeah, it's awesome. It's a great surgery. I really enjoy doing it. I think it's very rewarding. So, yeah, that's what it is. It is a tool. It is a tool. It's not a cure. It's not a magic wand. And it is a really good tool. It is hands down one of the best tools that we have for weight loss. No questions asked. We have been doing this surgery in our center for almost 15 years in an outpatient basis. The safety of that has been fantastic. We actually beat the national average by quite a bit. And efficacy has been excellent. But it's just a tool. And I tell people this all the time, like, you got to have, it's the procedure, it's the program, it's the follow-up thing, like with Nora and the rest of our team. Like, those things need to come together. And that's what really is going to help you get the most out of the tool to begin with and maintain the tool in the long term. So that's kind of what we want to just talk about, is that experience of how do you use this tool the best? What is it? What is it not? And help you kind of see what it is. This is a complicated slide here. Is just a glimpse into what our program looks like from a follow-up standpoint. Like, we have a very specific guidelines for portion sizes now and for calories that we want you to be on. Well, these are guidelines that we kind of generic, and then every person's different though, and everyone's life is a little different. Everyone's metabolism is a little different. Everyone's activity level is a little different, and how they tolerate food is a little different. So that's why you have to have a really good team that is following you to help you succeed with this tool, because your problems aren't, someone else's problems aren't your problems, or someone else's difficulties are not your difficulties. Your difficulties aren't someone else's. And so it's really helpful to have someone like a great team like Nora and Kim, our other dietitian, that are really experienced in this stuff to really help you get the most out of it. And you can see that, there's a we try to have specific, give you specific goals for every single one of these dimensions to it. Just generic expectations after an LSG, because it's interesting what some people's expectations are. You wake up and you're the same size. You're not any smaller. It's just the only thing that's smaller in your body is your stomach. And that does a lot, actually. It's incredible what happens with these surgeries. And I'll let the patients share their own stories. But you're not immediately smaller. It's not like liposuction. It's not like a tummy tuck or something where you're removing any fat. It's just the stomach that gets smaller. And the goal of these surgery is to reduce your hunger, make it more manageable, improve your satiety. And also there's some weird things that happen from a metabolism standpoint and from a fat burning standpoint and blood sugar management and blood pressure management, that those all seem to be improved for most patients. Your hunger is reduced, but generally not eliminated for most people. And you will get heightened restriction. So restriction being like, oh man, I have to stop. Like, I cannot go any further than this size of the stomach. We really advise people that the size of the stomach, the restriction piece, it's part of the tool. It's a helpful guardrail. But just like when you're driving, obesity is like, you feel like you're in this car that's not working very well, right? The steering doesn't work very well. The brakes don't work well. The throttle, the gas is, off and on like this or that. And it just is you're like out of control. And oftentimes people don't even feel like they're in the driver's seat of this broken down car, just bumping down the road. And what this surgery does is it really tunes up the car. Your steering linkage gets tight. Your brakes start working. Your throttles is smoother. And all of a sudden you're like, and it puts you in the driver's seat and you're like, whoa, what's this? I want to go over here. I can go over here. I can go over here. I can go over here. But you still have to have a plan. You still have to be paying attention. You still have to have a direction that you're going to go and a map of how you're going to get there. And also, when there's curves around the road, your goal is to okay, there's the curve, not run along the guardrail. And that's what I think when people eat to the limit of their sleeve, what they're doing is they're bumping up along the guardrail. And what's going to happen over time is that's going to stretch. So, I took a little bit longer than usual on purpose, because this is the biggest thing I see when people come back and they've gained weight after any bariatric surgery, is that they're pushing the limits of it. They're using the tool as like a bumper, essentially. Like, they're kind of doing this to the tool, and they're kind of thinking of it like bumper ball, and they're kind of like, oh, whatever, just throw it down there and it's going to get down the track. And it's not a great way to use the tool because it will wear out and break down over time. So, that's my thing. Color commentary, Rob, Nora, patience.
Thing that's nice about a sleeve, we saw the advent of this in our center, and we're the first in the world to do this on an outpatient basis, and we've done over 4,000 of them now. And it was wonderful to see this in evolution, actually, and to see how it now is comparable for weight loss to a gastric bypass. And people really actually promoted this, found this out early. People did their due diligence 15 years ago and were selecting this process above anything else that was actually supported by insurance companies at that time. So it was really quite a revolution to be able to be part of this and offer this. And so it's less, of a complicated operation than a bypass. Bypass certainly has its place, and we do bypasses in patients that need bypasses, but it's equivalent in weight loss. It has a very low risk profile. There's really no malabsorption to it. It's an outpatient procedure. It certainly changes how people interface with food, meaning how they eat. But it's powerful from a neurohormonal standpoint. One just observation, any of these weight loss surgeries, it's interesting. It just resets the body's weight thermostat, and it gives people a chance to actually lose the weight and keep it off long term. So very safe, very efficacious, and a great tool for people needing to lose weight.
Don't forget about the ghrelin hormone.
Ghrelin, exactly.
Yeah.
I thought Brandon missed. Thank you very much, Lisa. Yeah. One of the powerful things that happens, and Brandon, Dr. VanderWel alluded to this, people's appetites can be very powerfully controlled. Most of the time, right after surgery, people don't have much appetite. On occasion, people do. But I've got patients even years out. It's not everybody's experience, but I just talked to a patient recently, 5 years out from surgery, who has to remind herself to eat. And that is that ghrelin effect. It's amazing sometimes. Thank you, Lisa.
It's natural for people's ghrelin levels, because the stomach's not the only place that makes ghrelin. So it's natural for that level to come back up over time. But generally when I talk to people, everyone's still well, it's still nothing like it used to be, and you're still you're at 1,300, 1,400 calories, or even lower than that, 800-900 calories. Well, how would you have been if you've been on 800-900 calories, for several months? And people are like, no way.
Absolutely.
You just start laughing,
For me, when I first came to see you, I think that was one of my big things, is that we couldn't detect whether, I knew I didn't have and this is not everyone's profile, but my profile was really that I just couldn't get full. So, I felt like I just was this empty, never filled well of food. So it wasn't really even the quality of food that I was eating or anything. It was just that I couldn't feel full. And I think that that's been the most life-changing thing, if you're going to say that it's in its most simplistic, holistic form, is that I finally feel fullness. And that still is true for me, almost 4 years out from surgery. And I think with the hormone factor, because, and maybe Tina, you can speak to this too, because you do care about the quality of food, because you do care about feeling full, or at least from my experience, I care about making sure that I have satiation for the meals that I am eating, since they're smaller. I care about the quality of food that goes into my body. So it's this different approach of a complete picture of health. So that I think that has been the largest shift for me.
Mm-hmm.
Totally. I couldn't agree more, because I have, on a number of occasions, if I took a bite of something and I found that it wasn't worth the space in my stomach, I it out.
Yeah.
Seriously, there's prime real estate in there, and I want it to be good. And if I'm not enjoying it, why eat it? And it's much healthier. And my diet is a lot healthier than it was before. I really find things that I enjoy that I know are healthier. So yeah, that space is super important. So
yeah, it's precious space. Absolutely.
Uh.
It is interesting. And Dr. VanderWel alluded to this earlier. The stomach is bigger than it needs to be in the modern world. I mean, it's truly a survival organ. So, Lisa, what you said there, thank you for mentioning that. I hear that from patients, that the first time they've ever felt full is after the operation and after a few bites.
Yeah.
And so getting that and being able to change that is so powerful.
It's super powerful because I maybe I'm a little bit against the grain here, but like I believe in balance and I believe that, all foods are on the table. I feel like I'm kind of an intuitive eater, but for me, that doesn't mean I'm eating a slice of pizza. It doesn't mean I'm never going to have pizza again. It just means that I'm going to rethink it, right?
Yeah.
And like make
it's
sure
not part of your usual routine.
Exactly.
For sure.
I mean, I have 3 kids, so there's no way we're never eating again, right? It's just a matter of like when we go to Mod Pizza, I actually feel like I'd prefer a salad and I can add all of the ingredients there. It's not even like a question of craving, it's a question of actually prefer a salad, right? Like let's get, I think at some point, because the way that, let's be true, like real true and real, like the way that we got to when I was at my heaviest at 325, the foods that I was putting into my body and the lack of activity, and they were not actually helping me. Right? They were bringing me down. They were making me worse off. So relating that way of lifestyle to how I live now is just such a night and day different that I don't have a desire to go back to that way of living.
Yeah. And it's interesting. You guys can maybe give a little testament to this, but what I hear patients all the time is just like, I'm fighting my body, like they're like, I don't necessarily want to eat all this food all the time. It doesn't make me feel good. Like, I don't like it. I feel horrible afterwards, but I'm just like, why is just it? I'm just like it caught in this river, right? And you're just like trying to swim down upstream desperately, right? And, it's so interesting after surgery, people are just like, yeah, all of a sudden I'm just working with my body as opposed to against my body. It's just like,
and you're not obsessed with food, right? I don't know, Tina, if that's your experience too, but I have a lot of the same things every day. That's just my personal preference. I don't need to worry about the next meal or whatever, it doesn't consume my thoughts as much as it used to, and in all the right ways, right? Because I think that we do sort of have an unhealthy view of food in general in our country.
For sure. Yeah.
Even though it's cliche, like I feel like now it's like I eat to live and not live to eat, because it's truly like the same. I eat a lot of the same meals because I know it's good for me, it's healthy, makes me happy. And so, yeah, it's not, prior to this, I would have a meal and then I would already be thinking of what the next meal was going to be before I'd even finish that. And now it's not that way at all. It's so much better.
Yeah.
Kind of changing the generational like trauma and expectation and around this as well. I know that when I'm around family members who have any kind of like food dysmorphia or issues with obesity, it's interesting to observe it from this standpoint, because they might be enjoying a meal together as a family and then they're immediately talking about the next meal, and I'm like, wow, what's happening here? Like, we're kind of obsessed with this idea of filling whatever void that we have, or maybe what's lacking elsewhere. So I mean, I think it's totally changed my outlook on how we live.
Well, I think, for me, I think there's that generational perspective too of like, 50 years ago, life was hard. Life was way harder, like most people didn't have air conditioning, lot less sedentary jobs. I mean, I remember being out there on the farm with my grandparents, right? And getting in the tractor at 5 a.m. in the cold. And it was like not comfortable in there. And we were bumping around all morning. And it was like, life was tough. That's my grandpa put two spoonfuls of sugar in his coffee just so he could keep going, right? He needed the fuel. And now the tractors practically drive themselves. Like literally, you don't even have to be in some of them. Like they will literally drive themselves on GPS. And so it is just like a totally different world that we live in. And our bodies they are really not made to live in this time. They are absolutely not. It's great to have comfort and abundance, but the side effect of that is that obesity is going to be 42%, right? So in this country, and it's rising across the world pretty much everywhere except for Japan. So yeah.
What's interesting, it is Japan, but it's only the women. The men are actually gaining weight in Japan, according to the World Health Organization. Very interesting.
Yeah.
Cool. Well, I got some questions I would love to get to. Anyone else have any like quick things they want to jump in on any of those last tail things? Nora?
Well, talking specifically about the sleeve, I think sometimes people are interested in long-term risk of having an operation like this. And I just want to emphasize that everything gets better after taking out this part of the stomach. It's actually kind of redundant. We don't need it. It doesn't predispose to any other forms of death. Yeah. We do know with the weight loss, there's at least 16 varieties of cancer incidents that go down. So people gain 10 years of longevity and a quality of life. And really, it isn't going to compromise somebody's life long term. Just want to emphasize
say that again, though, because it's like taking out this much of your stomach has very, very few health implications long term, particularly from a cancer standpoint. Because I've heard this from several patients, like, well, am I going to get like cancer or something because I don't have that part of my stomach? I was like, no, your rate of cancer goes down. Your chance of cancer goes down on the most common cancers, honestly, and some of the most common cancers in this country. So,
including breast cancer.
Yep, breast cancer, colon cancer. Yeah. And then there's a bunch of other like esophageal cancer, like a bunch of the hormonally mediated cancers are much significantly improved. So Tina and Lisa, I got some questions for you. Like, why did you choose the LSG?
So I did a lot of research first before about the different surgeries that were available. And the reason I went with the sleeve is because I found it to be less invasive than like the bypass, and that it was one of the safest surgeries that had the least amount of risk of side effects. And that was a big concern to me. When you do research, you see a lot of horror stories that some of the things that can happen with some of them, and this just looked like it fit me the best. So that's why I went with that.
Yeah, I mean, I would echo that and the hormonal changes that I could expect. I was very interested in that as a mom, as a woman. I was 40, I think, just to turn 40 when I had made that decision. And since I had complicating factors like diabetes and hypertension and joint issues, I'm like, gosh, if we could fix the root of this and, my hormones can improve in addition, like, let's sign me up.
Yeah. No, and I think, okay, so next question. Well, thank you. What was your process to get to the LSG?
So for me, I had several nutritionists and my PCP that had suggested over the years that weight loss surgery would fit me the best with the issues that I was having. But the insurance that I had specifically had a clause in there that said they wouldn't pay for any weight loss surgery. So it was something I couldn't go forward with. So finally, we saved up enough to where we felt that we could go ahead and do it. And then I went in for my consult, and my husband got a new job, and his new insurance actually said that they would cover a portion of it. So one of the stipulations, though, was that I had to do 3 months with a nutritionist beforehand, which at first I was like super frustrated because I was like, finally, I'm going to get it after all these years, but now I got to wait 3 more months. But I honestly think that it was the biggest thing that helped me be successful, because that 3 months gave me time to completely changed my diet and research what I needed to do. I was going to have to lower my carbs. So I like slowly did it. So it was like not this big jolt, like, okay, eat how you've been eating all these, bad habits you've had up until you have the surgery, and then suddenly change it all. So I think having that time to figure it all out, find what worked for me in the diet changes, helped me be a lot more successful. At least that's my feeling on that.
Yeah, no, I tell that to people all the time too. This is a tool, and you need the right skills to get the most out of the tool. And some of the nutrition skills are huge. So And before you jump on, Lisa, Nora, could you kind of follow up on that? I'm just like, what do you guys usually work on in that 3-month supervised diet? And when people don't have a supervised diet, what do you usually recommend them to work on and to help with?
For sure. The first thing I was going to say is that, I always tell my patients obesity is a chronic disease and it needs chronic management, right? So patients start with us before surgery and we want them to continue after surgery because, again, you have this tool. We want to help you use it correctly, but there are sometimes that you fall off track. We help you get back on track, keep you motivated. And if you're struggling with something, we can help you with that. So it's not, as you said, it's not a fix at all. It's just a tool. But yeah, so a lot of times, we want to teach patients protein is important, right? Why protein is so important? Because it's literally part of every single, organ of your body and enzymes and all that. You need the protein and we want to make sure we keep the muscle and lose the body fat. So okay, how many grams of protein? We teach patients about how to count protein, what protein foods are available out there, what are the protein shakes and all that. Fluid, why water is so important. And there are all the rules with the fluids, just helping patients. And yeah, it's a good idea to start practicing all that before. So when you get the surgery, you're like, okay, I remember I got this. Versus if, as Tina said, you do this diet for a whole life and then now you're going to change it overnight, it's not going to happen. It's going to be really tough. But also, I think him and we also talk a lot about the emotions and how a lot of times the emotional eating piece also could be one of the contributors to the weight gain. I always tell my patients, I think all of us are emotional eaters to some degree, but some people have a better handle on it, compared to others. And after surgery, how this is going to change, right? Because when you're emotional and sad and happy, food is not going to be your friend. And how are we going to deal with your emotions and all that? Yeah. So
it's a huge one.
Yes. Yeah, exactly. Right. And then also one of the biggest thing I see is the portion. As Dr. VanderWel said, we like to give patients the guidelines of this is how much you need to eat, right? Because a lot of times, as you said, people are like, I'm waiting for that cue, oh, if I have one more bite, it's going to come back up. And that's when they stop. And that's actually the wrong time to start. You already overdid it, right?
Yeah.
So, and a lot of times just learning about this small portions, but also getting your eyes used to small portions. I have some patients after surgery like, are you sure? Is this enough? Am I going to get malnourished? This is not enough, right? But it's just amazing to see how little we can eat and still survive and live, right? So it's
incredible how efficient your body can be. Yeah.
Our bodies are smart. Exactly, right? So our bodies are smart. They adapt. So
every year for Christmas, Rob gives me some book on the extremis of human adventurism and what they can survive. So every Christmas, I'm like, man, there are some people that have gone through some tough stuff. And I was like, man, we have it so easy. It's so easy. No wonder we struggle with obesity. So
I'm like, whenever I think about a zombie apocalypse or something, I'm like, oh, I'm fine. I'm fine.
Yeah. Yeah. No, I that's the one thing I recommend to patients too, is to really work on, just start measuring your portion sizes in a cup, just to begin with, just to get in the habit of it, because it's a skill, and like any skill, you're gonna need you're gonna not be good at it sometimes, and you're gonna be like, man, I really suck at this time or this event, or especially at dinner time, right? People overshoot dinner all the time, and that's hormonal. Like your stomach is naturally it's loosened its capacitance, and it wants to have more food, and there's a big dopamine hit when you're for a lot of people when they're with their family and this other things at the end of the day and all these other things. And so really training and kind of just kind of struggling, honestly. I tell people, struggle, try to start a little bit of the problem solving now, because these problems will not be magically solved by a procedure, and your lifetime of eating habits are not magically solved by this procedure. It helps a lot, but it's still not, it's not gonna do everything for you. So Lisa, what was your process to get to surgery?
Yeah, so I feel like I had spent a lot of my adulthood, especially after having kids, things just for my health just started to really go downhill. I had my last at 38, and, you know, I had I had all high risk pregnancies. I had 3 kids in 4 years. And a lot, I just had hypertension. I had, I had all the things, and I felt like I eat healthy, I'm active, but why am I so heavy? Why can't I get rid of all this? So I had been working with my PCP for a while. All of my doctors, right? Like we couldn't kind of narrow down any one thing. I had decided to start dieting around, I was around 39, and I'd started dieting, and I was successful to lose 40 pounds on my own. And I was so excited because I was like, oh, maybe whatever it is, I've figured it out. And I went to my PCP and got my blood results from like a recent blood test, and my A1C had actually increased to diabetes. And I was like, how does this make sense? Right?
Yeah.
Like, don't get it. So
ouch.
She said, I had started looking at gastric sleeve at that point because I felt like it was the next logical choice for me, because I didn't want to keep aging and continue, even with my effort and a good amount of effort and help, right, from doctors, and not find the resolve to find health, right? So she actually said to me, I was kind of embarrassed to talk to her about bariatric surgery, because I was, there's a stigma. There's this ridiculous stigma that we still have on it all these years later, right? And she's like, actually, I love the idea that you have for gastric sleeve surgery, because she would prefer to give me a resolve that would give me the health like that I was looking for, versus medicate me, because we know that those diabetic drugs, some of them actually do perpetuate the problem to obesity, right? And you can't ever get kind of what you need so that you can get out of type 2 diabetes. Yeah. So I came, 3 days after I got my diabetes diagnosis, I was in Dr. VanderWel's office, and he's like, well, how long have you been diabetic? I'm like, I don't know, 3 days. No, it was a lot longer than that, because it was all through my pregnancies. But when we finally got there, I was very fortunate. Again, I think I'm always kind of against the grain a little bit, but I was approved really quickly because I had all those markers. I had been working with my PCP. I've been trying to figure it out. I had been successful at losing weight on my own even, but after years and years of dieting and trying to figure it out, it just didn't come to resolve. And then I got sick, right? So I was approved pretty quickly within a couple of weeks. We had really good insurance at the time, and they approved me. And then I think it was like 6 weeks later, I was on the table. So it was kind of a fast process for me, but I was ready. I had been doing a lot of that work on my own. It wasn't new to me. I was already doing kind of a low carb, high protein diet anyway. So, the surgery part I feel like was the simplest thing out of everything. The surgery was like,
great segue to my next question. What was the recovery like?
Yeah, I mean, I don't know for you, Tina, but since I'm already talking, I'll just share real quick. But fast, I mean, it's 45 minutes, an hour? I can't remember.
About an hour. I tell people about 50 to 90 minutes from like when you walk in to when you roll out.
Yeah, it was real fast. You're going to feel groggy from all the things that surgery does, whether you're getting your teeth done or you're getting part of your stomach taken out. I think it was actually easier than my gallbladder surgery, which I lost a couple of years before. And gallbladder surgery is the easiest surgery I've ever had. So associated with that. So I would say that like the gastric sleeve is probably the easiest surgery I've ever had. And then the recovery was just, I planned ahead. So I worked with your nutritionists, and I sat down and we went through our book to kind of figure out, what I'd be drinking for the first couple of weeks, then eventually eating with soft foods and solids, over the course of a few weeks. I had that all fixed already in my fridge. I was very disciplined about walking and moving my body from basically this first day. I set an alarm to sipping my water every 15 minutes. I mean, I was very disciplined, but I think my recovery was better and faster because of that.
Yeah, mine was pretty smooth. I mean, I had sleep apnea, so I did have to stay overnight after the surgery. So that was a little different that way. But and everybody there was amazing. They were like so helpful and awesome, and it was a fantastic experience. And yeah, so I went home, and also my surgeon at the time said, like, from day one, get up and move, get up and move, and, like, walk out to the mailbox, and then each day you add a little bit more. So I was the same. I was moving all the time. I was, setting alarms to drink as well, and had prepped everything to be on hand. So it was like super smooth. I was maybe on the pain meds for 2, maybe 3 days. Then I was off them, and it was just really fantastic for me. I didn't have any issues with the recovery. Everything went smooth, and everything was prepared. And yeah, just moving, I think, is super important.
Yeah, for sure. Definitely. When were you guys able to get back to like full activity?
You mean like everyday stuff, or like exercising specifically?
Both. Yeah, both.
So as soon as this, I like had on my calendar, like they said, probably 6 weeks before you can start exercising. And it was 6 weeks exactly. I was able to get back to regular exercising. So I was super excited about that. And probably just like everyday stuff, probably after a couple of weeks, it actually was pretty smooth for me. I didn't have any issues. And yeah, I was able to get back to regular stuff probably a couple of weeks. But I mean, it is major surgery, so your body is still recovering for longer than that. But
you're still a little bit tired. Yeah.
Exactly. Yeah. But yeah, and 6 weeks, I was starting to do all the other exercise I was told I could go ahead and go with. So yeah.
Yeah.
I don't feel like I ever really slowed down very much, but my life is a little bit different since I have little ones at home. They don't let you.
Yeah, so, no rest for the weary, right?
But it's full activity. When I started getting on a program, I was pretty overweight and I had really bad joint issues. So I wasn't actually comfortable personally with exercising until about 4 months, which is probably longer than I would suggest. I should have probably done it earlier. But I'd say when I had lost my first 50 pounds, maybe it was more like 90 days. When I lost my first 50 pounds, I was ready because my energy was completely restored at that point, and I was ready to go. And I bought a Peloton bike. So that's when everything changed.
Yeah, you're an animal on that thing.
Yeah, different person.
Yeah. Nora, you usually see people at 1 month, right? After surgery for nutrition visits. What do people usually look like at 1 month?
Happy. Very happy, and they're
very happy to be not on purees anymore.
And they're always asking me, like, are you sure I had surgery? Because I don't have any symptoms. Because I think, as Tina said, like, sometimes you go online and read all these horror stories out there, and you think that you're going to experience every single thing. But I think we do a great job of educating patients before surgery, and it's like, these are the guidelines, you're going to follow these and all that. Yeah, so most patients are great. Like at the 1 month post-op, patients are normally transitioning to regular foods. So we normally talk about if they're having any intolerances and how we could, I guess, deal with that, and how many grams of protein they're getting, and if they're struggling, what can we do to improve their protein intake, and like if they're having any symptoms, like if they're feeling some, nausea, how can we deal with that? A lot of times, or most of the time, is because patients are eating too fast, right, or drinking too fast, which your stomach is like, no way, it's like we cannot do the same thing we did before surgery. So but most patients are doing fine. As I said, the two things I always hear from patients are you sure I had surgery, and I wish I did it sooner. So I hear that a lot from patients.
Yeah. Rob, you can type in here too. Give your comment on one. Yeah. Rob and I see the patients at 1 week after surgery. And usually patients are like, starting to get back to work. For the desk job people. The desk job people are thinking about it. Or are already there. Like, I think all my post-ops that I did this week, everyone was at their work, doing a post-op at work. The goal of surgery is not to get you back to work as soon as possible. It's to change your life. So I tell people all the time. whatever we need to do to set you up for success long term, that's what we're going to do. Totally support that. But yeah, it's really interesting too, like, because they're on the calorie amount's low. It's usually like 450 to 550 calories in that first week or so. A lot of times people are like, well, I have a little bit of hunger or something. I don't know. I don't feel super full or whatever. And I was like, is this working? Did we do anything? Like all those things. And I say, okay, if you were on 500 calories for a week before surgery, how would that be going? And everyone's just busts out laughing, like, oh no, that's not happening. That's not a thing. Yeah. So it's so fascinating to see how the hormonal changes that happen with surgery really do change your body from like just desperately holding on to that weight and do not like, it's like, no, this is a strategic reserve. We do not touch. This is for the winter time when we're going to die. Right. And the famine comes and all of a sudden, like there's just some switches get flipped and it's all of a sudden like, oh no, let's go. Let's throw it in the fire, burn it up, and honestly, to a degree, it doesn't even make sense. Like some of the weight that people lose in the first couple of months is from a metabolic standpoint, they usually think of like 3,500 calories as being a pound of fat. And when people are losing like a pound a day for days and for weeks on end, for some of them, it's not everybody, but like their basal metabolic rate's not even 3,500 calories. Like, what is happening here? I guess that doesn't even make sense. I mean, some of it's water weight. Mysterious. Nora, you did a fantastic job, fantastic little blog recently that we're putting out about, like why you lose so much weight at first, and then you're gonna have stall and all these other things because there's a bunch of water weight that goes with that stuff. But there's a lot of things about these procedures we don't even understand, about how they're working on stuff. So. Rob, what do people usually look like for you when you see them at 1 week?
Yeah, couple of things. When I'm coaching people like at their pre-op appointment to take the time after the surgery, because a lot of people bounce back fast. Everybody's different, right? You'll have people doing, back handsprings in a week saying, really? And they're almost like back to full activity. That's a little bit of an exception. You got other people need to take a little bit more time. But I tell people, definitely take the time you need to physically heal. Okay, because there's a physical process that you have to respect, particularly in the first couple of weeks. But I also tell people, as important as that is I tell people it's like talking about having a baby than having a baby. Weight loss surgery. Talk about weight loss surgery and having weight loss surgery. It's not necessarily the same thing, right? So I tell people, take the time you need to get to know your new anatomic baby, because this is going to shake up how you eat and so forth. And getting your head wrapped around what just happened is kind of a big deal. And so if people can take a little bit of time afterwards to get into a new rhythm, a new paradigm, I got this kind of attitude, I think that can also help. I used to think we'd make people activity-wise, that we could potentially cripple them by doing these surgeries, right? That we would compromise their ability to be active. And I think probably, Lisa, Tina, you probably know this better than anybody. This allows you to do the things you actually want to do.
Yeah, you ladies are freaking crushing it. I mean, like,
unbelievable.
I was running this morning, I was like, I bet this isn't as good as Tina does.
Yeah, there you go. Exactly. At 1 month or 3 months, the complaint I hear, very similar to what Nora said, she said, I wish I'd done this sooner. The other one I hear very commonly is, I haven't felt this good in years. Mm-hmm. So it is really a wonderful, quick change. And here again, everybody's experience is a little bit different. It's like you get 10 weight loss patients in a room, surgical weight loss patients in a room. It's like 10 moms talking about their birth stories, right? So everybody's got one. It's not necessarily the same story, but it's a good story to hear.
I totally agree with that, Rob. I'm healthier now than I was at 25, and I'm 44. Like I'm going to outlive everybody at this point, unless I, tragically have some adventure.
Don't have a hang gliding accident.
No.
Yeah, completely. Like I turned 50 this year, and I'm the healthiest I've ever been. Honestly, it's amazing. It was life-changing. I tell people that having this surgery saved my life. Because I have fibro, and then I also had sleep apnea. I was on high blood pressure medicine. I don't have sleep apnea anymore. I got off the meds. Managing with my fibro is manageable now. It's just amazing to change it. This literally saved my life.
Yeah. What is your guys' routine now?
I still, even 6 years out, I still weigh and measure my food every day when I'm doing my meals, because I mean, it's really easy to let things slowly build. So I still weigh and measure my food. I track it every day. I still exercise 6 days a week. You know, I do running 3 days a week or walking 3 days a week, and then I do weights 6 days a week. You know, do yoga. I'm way more active with my family, because like at my heaviest with the fibro, even just doing everyday daily stuff was so hard. It was so difficult, and I was missing out on things with my family because I couldn't physically keep up with them. So it's just nice to be able to do whatever I need to do with my body now.
Yeah, I took my kids to a little jump place a couple days ago, and there was rock climbing, and I was like, I can do that. You know, like definitely not something I would have done, you know, just 3 years ago, 4 years ago. And it's really fun to watch my kids just get excited about how much more active I can be for them and with them. Riding bikes, paddleboarding. We sometimes just race to the car, and they're much faster than me, but, but like,
you can at least make it competitive.
I can watch on my heels, like she's gonna get me, right? So it's nice, you know, and being strong, you know. I think more than anything, Tina, you probably agree with this too. The strength training and the building that I'm doing in gains is so incredible, like what our bodies can do, and
It's really
how
empowering. Yeah.
it is empowering, you know, being able to do just everyday things like lift 6 bags of groceries and not need my husband to help me with that, you know, whatever it is. Like, not that I get that many groceries anymore. It's more like 4 bags, but, but yeah, I mean, the activity, my husband says that I am addicted to exercise. I'm not. My body just enjoys, am I coming in and out?
I just lost your camera.
We can hear you.
I can hear you.
Okay, I don't know what's going on with my Teams, but
It's okay. Your voice is there.
Okay, there it is. Yeah, it's my life, like that. What did I say? And I think one of our conversations, Dr. V, like, this is just how we live now, right?
Yeah.
So it's not a matter of lifestyle so much. I hate that term because there it goes. Because I feel like it is a lifestyle, but really more importantly, this is just how I live, right? So it's like breathing, it's like brushing my teeth, right? What I put in my body, how often I move my body, it's natural now. It does take effort and discipline, but that's the priority, right? It's not a matter of avoidance. It's a matter of like diving in.
And it's doable now.
It's
right.
doable.
I think that's what I think. I try to always ask patients of like, so, the follow-up process, right? Nora's kind of talked about it a little bit. And I'd love to hear your perspective, Nora, on this issue of like, what do you see with patients that is like the routines that patients that are really successful at this, what are they consistently doing? But, that process of being more active and tackling these things and having a plan, I think well, I don't know what you ladies would say, but that may be even a better part of this journey than what the scale says.
Yeah, I look at it as celebrating what my body can do now, because it is so much healthier and stronger now. I enjoy it. So I enjoy my exercise. I look forward to it every day.
Mm-hmm. And just think about like if you had tried to do this whole journey without surgery, everyone I talked to is just like, it just was not going to happen. Like they've tried it too. Like they have really done it. And I tell people, like, when people are on the fence about weight loss surgery, one thing I tell them too is like, well, here's a sample diet plan of like, here's an eating style, track your food, measure your portion sizes, eat these sort of things, try to increase your activity of this, get some sleep, manage your stress. If that doesn't work to hit you, if you don't hit X metric, come back and see me in 9 months, because these tools, they do some really cool stuff, and there's nothing like them out there. There really isn't. And there's a reason that people do these things and that they work well. So
I would say that your team is so gracious about that. I never felt pressure. I never felt like anyone was trying to sell me anything. I just felt like, here are your options. Here is how we can help, right? And to your point, like, that time is going to pass no matter what. I would rather in 9 months lose the weight that is needed to get off my body so I can start living a better, like a healthier life, rather than spend 9 months wasting, in my opinion, my energy trying to do something. I mean, whose hero am I really? Like, I'm not like trying to solve anything but my health. So why not use the tools that are given to me that you all specialize in to actually get the job done?
Mm-hmm.
Yeah, I like that, Lisa. Yeah, I think I tell people too, these surgeries are life extending. Statistically, you're going to gain 10 years of longevity and a quality of life that's really hard living big. But I tell them it's got to be the right thing, done in the right way, at the right time. There's no rush. You want to be prepared. I mean, it's a life-changing, life-extending operation, and it's completely elective. And we know some people who aren't ready to kind of change those elements that are essential to do well, they're not ready for weight loss surgery yet.
Yeah.
So being patient, methodical, doing it in the right time frame, essential for success.
Yeah. Yeah, if people kind of think of weight loss surgery as like weight loss therapy, or I mean like retail therapy, like you buy something and automatically like it fixes all these things in your life, right? Which is always a fallacy on that stuff too, But it really is a tool. And if like when I've bought tools, it's like, oh yeah, I just totally need this tool. And then later I'm like, oh, well, I'm not using that tool very well. I'm not using that very often. I should have put my energy somewhere else in that time. Surgery is a tool, and you need to be able to invest in the skills that are going to help you get the most out of that tool. So
yeah, and it's easier to do those things on this side, I will say, because it's a tool. It's easier.
Yes, it is.
Smaller portions and move the body and do the things because I'm now in health, so that's the aid, right? Is that that's
just the hormonal, like the stuff that happens inside the body, all these things that could just get flipped, like it is a completely different ballgame. But if your mindset's not like, if your goal is not, hey, I want to have healthier food choices with smaller portions, like if that's not your aspiration, you're like, I really want to have a lower number and have my clothes fit better, but I still want to have this lifestyle of like not really having a plan and eating crappy food all the time and just like reacting to my life. It's I'm not judgmental about that, because I have seen people that have gone into surgery in that fashion absolutely crush it afterwards. So we always joke about this all the time. We're like, man, this person is like not have their act together right now, and then they are
people
just
surprise
rock
us,
stars, like total rock stars all the time. So I'm like, I don't judge.
Surprise us.
That's why I'm not like a really strict about, oh, you're just not doing what you're told right now, so you are not going to be successful with this tool. That is not my experience, but it absolutely does help. It does help. It definitely helps you if you get some progress to going, you're hitting the ground running. Sorry, to come back to my one question for you. The thing I was hoping you could give some input on, Nora, is like, when you see people that are really successful with these tools long term, what is something you consistently see that they're doing too?
So I normally tell my patients that the first year is your golden year, right? So most of the weight loss happens the first year. It doesn't mean that afterwards you're not going to lose weight, but we know it slows down, or sometimes it gets a little bit harder. And the first 3 months is very crucial, because the habits you get into the first 3 months is really going to stick with you, afterwards. So, going back to your question, Dr. VanderWel, is that the patients that I see successful are the ones that are eating every few hours, right? No matter what. If they are going out, they're going to take a protein shake or 2 protein shakes, put in their purse, whatever, take them with them, right? Because we know when people are skipping their meals, they're not going to reach their protein. They're going to end up really hungry at the end of the day or at night. So their portions for dinner is going to be bigger, right? Or they're going to have a lot more cravings after dinner, right? With sugar and sweets and all that. So that frequency, I see that all the time. When people are not eating every few hours, their weight loss slows down, or they're going to regain the weight because of, as I said, the portions and the cravings, right? And tracking, very, very important. I know not everybody like Tina loves to do that, right?
That's
They
pretty
hate
impressive. I'll just say
It is
that's
very,
impressive,
yeah,
Tina. Seriously,
yeah,
that's a suit that you want to keep playing.
Yeah.
That is a really powerful thing to be able to do that. So
yeah,
Yeah, I figured
absolutely.
for me this far, I'll just keep doing it.
I love it. That's great. And yeah, so I mean, Tina is again very, very impressed by you and doing that. But some people don't like that. And I'm okay with that as long as you are seeing success, right? But sometimes we have to get you back on the tracking to figure out how many calories you're getting. It's just a reset, right?
Yeah.
Pretty much. And
Yes.
you're like, okay,
So
this is how many
mindfulness.
calories. Okay. Exactly, right? And then, okay, we're on the track now. We could just stop for now and see how that goes, right? Fluid. People that are not getting enough water, they struggle. We know water really helps with a lot of things in our body, but again, we know that when people are not hydrated, they do have more cravings and they experience more hunger, right? So people that are really, really focusing on their hydration, very successful. And the last thing is actually exercise. I know we talked about that, but I actually had this discussion with somebody else today, a patient, and I think people always think that they need to do CrossFit every day or Orange Theory or something crazy for it to work. And that's not true. If you could do yoga at home using YouTube videos, do that. What is it that is going to be realistic for you? And I think if
you have
people
a
are
3-year-old or 2-year-old that you're chasing around, I had that
Yeah.
I had that conversation with one of my patients. She's
Yeah.
2 years out. She's just doing so well. She doesn't
Yeah.
work out per se, but she's
Yeah.
always busy.
Yeah, right, exactly, right. And just like the goals for exercise needs to be realistic for you, right? So
And
Exactly.
improvement. Yeah.
exactly, right? So if you feel like you can walk every day, that's fine, but can you walk when it starts raining and being cold out? Will you be able to do that, right? What is it that you can be like continue doing no matter what happens, right? So I guess if I have to summarize it, the people that eat every few hours, get their protein, get their fluids, and do some sort of activity, right? We know the recommendation is 150 minutes per week, right? So if you want to do 30 minutes 5 times a week or whatever, I think those are the patients that are very successful.
Yeah. Yeah, absolutely. Tina, actually, I'd say a lot what you told me a long time ago, actually, I say this to other patients too, is like at the year visit, I say one of the things that's really helpful to continue seeing success is just keep doing a little bit better. Just say, hey, I'm just going to do a little bit more, and that's really powerful because you're like, hey, I think you ladies both have done a fantastic job of that. Hey, I'm just going to keep going a little bit more. And you keep building on that success. You never like pitch your tent. You're always looking for that next mountain. And it doesn't have to be mountain. Honestly, it's just like, well, I'm just walking a little bit further this time, or I'm walking a little bit faster, or I'm finding some hills to walk up, or now these are getting boring. And so I guess I'm going to jog now, I guess, or, I'm going to do whatever, thing on whatever dance class or something. But, I think that's what's honestly the coolest thing of the scale is not the coolest thing about this journey. It really isn't. Like it's everything else that goes along with your life that gets better. So it's super cool. So
yeah, I would say is the least interesting thing about me.
What's that, Lisa?
Weight is the least interesting thing about me.
Yeah.
It's not that
absolutely
anymore.
And Dr. V, I just wanted to add something else actually was the patients that actually also show up to their appointments.
Yes.
Right? Very successful, following up the program. It's really easy to show up when you're doing well and you're killing it. It's really hard to show up when you're not doing what you're supposed to do. And actually, that's the time that you need to show up to those appointments because none of us are.
Support. We're just
exactly,
support. We just want you to get better. I mean, it's
exactly. Yep. Yeah. We're
Let's do
not
this
we're not here
together.
to judge you. We're
Not
here
here
to
to
help
beat
and support
anybody
you.
up.
Exactly.
Nope. This is
Yeah,
a
and I
tough
think
battle.
a lot of times I have people like, oh, I'm glad that I showed up, because then, we talk about a lot of those things and find ways to help you. But if you don't show up, we don't know what's going on with you,
Yeah.
right?
I
So
think
And the nice
support-
thing with televisits is it's so easy now. It's so easy. Doing like a 15, 30-minute visit, just on a break sometime, it's just like in your car.
You don't have to drive from Blaine. You don't have to drive from Vancouver. You don't have to come
Yeah.
from Wenatchee or Cody, Wyoming or Fairbanks, Alaska.
Yeah.
Boom, we're connected. We talk about things, get a plan at the convenience of everybody. So
Yeah, I had my surgery, 3 weeks before the pandemic, and
Yeah.
Right.
how can I be this successful? Because my care didn't stop. Like, I could still check in with you, I could still see you, I could still send email or whatever. And, I never felt alone, even though I was home.
I have patients all over the United States. And I mean, I just did a patient from Africa. And
Oh,
we
wow.
we follow up just like normal. Like literally not missing a beat. Not a problem. I mean, the time changes a little bit, we've got to work around that for some of those people.
8 hours, probably 8 or
it's
9
doable.
hours. Yeah. That's great.
Yeah. Ladies, what's been the hardest part about this journey?
For me, I think dealing with the emotional side of it and the emotional eating and changing the mindset around that was probably the hardest for me.
I would say relationships with other people. One thing that I noticed changed was if anyone in your circle or even external to you might have food dysmorphia or, some kind of issue with their own weight and identity, you don't realize like your weight loss and how it affects other people and how they deal with their own things. So I found
Great
that
observation.
sort of a shift for me. Not that I did read Bariatric Mindset before surgery because I wanted to understand the mindset, and that was a section of the book that I literally just like skimmed through because I was like, that's not gonna happen. And it was the first thing I noticed. Like, I lost my first 30 plus pounds, and my body did start to look different. Not to me that noticeably, but to other people, right? Especially again through the pandemic. If I would go somewhere, even if I'm wearing a mask, people can start noticing, is that Lisa? Like, wow, she looks very different. And then maybe they follow up to me, in Instagram or in text message or something. And conversations are different. And how we live our life and how the changes that happen in our life, we're very social creatures, right? And we're very external to ourselves now because of social media. So it's just something to be aware of. Not bad, not good, just an observation that like, don't let it hurt how you decide you want to show up for yourself, because I think that you have to continue to do that, because at the end of the day, it's really about your health, right?
It's huge, Lisa. That's absolutely huge, and thank you for bringing this up, because what I found hearing from patients afterwards is people to respond to them differently and generally fall into one of two categories. It's pretty binary. There's going to be people that know you have weight loss surgery. There's going to be people that don't know you've had weight loss surgery, but they will see you and notice the difference. And there's kind of a litmus test for this. If the person is giving you high fives and saying, whatever you're doing, keep doing, girl, geez, those are your cheerleaders. They got your back. But interestingly, there is an unfortunate cadre of people as you're getting better, whether they know you've had weight loss surgery or not, they're not happy. It affects them just exactly like you said. It hits something in their psyche and they can come at you a little bit catty. And this is the deal. That can make, since we are social beings, that can make us feel uncomfortable. We like people to be happy. We like to take care of people. So now there's somebody in your life, could be a family member, could be a colleague, could be your next door neighbor, somebody at your church, and they're kind of saying things or looking at you different, and it can kind of make you uncomfortable. This is the deal. I encourage my patients to be unapologetic for getting better, to be empowered through this. If somebody says something catty, to almost be ready for it. Be empowered to say, well, thank you for noticing. Yes, I'm working to get better, and I'm actually really happy and proud of myself. instead of going, oh my gosh, I got to gain weight to make this person happy, right?
Yeah.
So identify who those people are,
Mhm.
come up with a proactive game plan. Don't let Aunt Myrtle sabotage you with another piece of cheesecake. It's like the magic word isn't please. The magic word is no. The magic word is I got this.
Yeah.
So thank you for bringing that up. That's huge.
Yeah. I would say these are the two biggest things, that are the hardest that you guys have just said. And everyone kind of goes into it thinking it's going to be their relationship with food. And I think it's the emotional piece and it's the social piece. Yeah. Tina, like what would you say to people that, because I mean, it is most patients. I mean, food is our hunger and food are essential to human life. Like you can't survive without it. There are multiple redundant pathways hormonally to make you drive for food, for you psychologically to connect with food. And so psychological coping with food is very, very common. And when after surgery, like that food gets ripped out from underneath you, like that rug is gone, and all of a sudden people are floundering a lot of times. And what would you ladies say to people that have like, because that's a place that I think that's a piece that people should be prepared for, of like that emotional element of it. What would you recommend people do, and what encouragement can you give to them?
So you got to recognize that when you're going in the pantry, you're opening that fridge, that it's not because you're hungry, it's because there's something going on that's making you feel like you need that to fulfill the emotional aspect. So recognizing it first, and once you do, having a good support system is like phenomenal to be successful for this, because you need to work through whatever is going on that's making you reach for that food. You need to have somebody you can talk to, hopefully. You need to find other things to distract yourself from it. So if I find myself in that situation, I'll either talk to somebody, my husband or my best friend, somebody I feel I can talk to about whatever is making me reach for that food. Or in addition to that, I'll find something else to do, like do a puzzle or read a book, or even go out for a walk which is also helpful in that it gets you away from the food.
Yeah.
So first and foremost, recognizing that that's an issue, and then finding substitutions for that food in place of it. And usually if I can distract myself enough or talk to somebody about whatever it is that's going on that's making me want to fill that void with the food, I usually feel a lot better. Or I've forgotten that I wanted to go grab whatever it was out of the fridge or the pantry and get through that hard spot.
Well, Tina, I think that's advice that can work for all of us. I mean, seriously, what you just said was powerful. I'm like, yeah, it's evening. Gosh, ice cream sounds good. I think I'll go for a walk. I'm gonna use that one.
Yeah.
So I am an emotional person, but I'm not an emotional eater. I am way more intuitive on this side than I ever was in the past. So if I'm grabbing for something, I'm usually hungry. So I have a couple of tools that I use. If I am craving carbs, I always pair it with protein. It's just a natural thing for me when I'm having my meals. So for me, everything has to be very, very simple, because if it's complicated, I won't do it. So
Yeah, truth.
I do protein and plants as a basic principle for most of my meals, and that can look like a myriad of things. I don't believe that carbs are the energy. I move too much not to eat them. I just eat them in the correct portion of, carbs, and I prioritize protein, first. So if I have room for the rest, awesome. If I don't, oh well, right? Like no big deal. I use very simple measurements in my head, like you don't have to clean your plate. That's something that most people believe, no matter if you have a weight problem or not. Everyone wants to clean their plate because grandma or mom or dad or somebody is going to tell them, don't leave until you finish it. It's something we practice in our home, where they know that they eat until they're full and then they push it away and they're good. So we're not going to repeat this, as we're growing as a family. And then when I'm out with friends, because there's that social element, you guys, I go out with my friends all the time. I mean, not all the time, but a couple times a month, I'll go out with my girlfriends. And now we're in the habit, they know that I'm either going to ask to look at the children's menu or I'm going to order an appetizer.
Yeah.
Enough food for me. No one's weird about it.
Happy hour for the win. Happy hour. Yeah.
Love a happy hour. And it's totally fine. But when we were first getting started, there were a lot of questions like, oh, are you sure that's enough food? Are you still hungry? Blah, 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 blah. And it never bothered me because I've always been very open about this. This journey I purposely put online socially because I wanted to sort of like divide the people, right? Like the people who are going to support me and the people who aren't. It was going to be really clear who those people were. So once again, simplifying and not having to overthink it, because I'm doing this no matter what, and I'm eating this no matter what, and I'm moving no matter what, because it's not about you, it's about me and my future, right? So I think you have to so one thing that I guess the last thing I'll say is that something you said to me, Dr. V, actually, was that now it's going to get hard. So I'd lost 90 pounds and I knew I was going to have to lose another 30 to 40 pounds, which inevitably I did, but it took a really long time.
Yeah.
And unlike Tina, I didn't track. I know there's two schools of thoughts for this. I think that you can be successful at both. It really just depends on what your tools are and what your methods are, right?
Exactly.
Yeah.
And the diversity. Sure. This is what's so beautiful in listening to both of you is you're sharing the diversity of your journey and how each is successful and trying to find that pathway that's unique for you to get you there. There's different avenues and I love it. You guys are knocking it out. So sorry, Lisa, I may have interrupted.
No, not at all. Tina, like I'm always impressed by people who can track and be disciplined that way. I'm disciplined in a different way. And
me too. There's no way I could track for a year straight. It'd be so hard. So hard. Tracking is so painful for me.
It's painful for me.
And Tina, nothing but
I feel
respect.
for it. I
Nothing
feel
but
for you
respect.
guys.
Keep
I
doing what
really
you're doing.
do.
When people do it, they can be wildly successful. Like I'm not poo-pooing it at all. I think it's phenomenal. For me, the simplicity of just taking a scoop of tuna and mixing my veggies in it and like putting it in a thing and throwing it in the fridge, it's just easier. I know how much is in there because I eat so much of the same stuff, right? Yeah. Like cracking a couple of eggs and throwing some veg in there, easy. Like I know that I'm like and I've successfully lost 140 pounds and kept it off for almost 4 years. Like something I'm doing is working, right? So, and I haven't honestly, I tracked it first, Nora, I did track it first, but it was really hard for me. And I found that it made me personally just a little too obsessed. And also always checking whether or not I was eating enough or not eating enough or whatever. I wanted to get really, really, really good about understanding my hunger cues, understanding my fullness cues, understanding all of those things from like a deeper level in my body. And I needed to get really good at that. So now I am. So I know if I'm reaching for food, I am hungry, because I can feel that in my body. And so I need a cheese stick and maybe a couple of crackers and we're good. It's okay, right? Like the world is not going to implode, right?
The thing that you guys have that's common is mindfulness. Mm-hmm. It's very interesting. I just had this analogy come to my mind. It's like both of you guys are doing music and the music's a different style. Yeah. But I mean, it's a healthy rhythm that each of you has hit. And it sings its own song, and they're both great. So, I want to dance to those tunes.
Also, you can have ice cream if you have it in the right portion.
That was going to be my next question. Is there any foods? What can you recommend? What can you tell people about what your diet, what your food choices kind of look like, and what your approach to food is? And if there's any foods that are completely off limits for you, like your stomach just doesn't let you do them, because that's a big question, actually a big hang up a lot of patients have that are like, there's such a big fear and an unknown there of the future of their relationship with food, which has been,
So for me, I was really fortunate that I've not come across any food that is a problem for me. I've been really fortunate in that. So I don't have any issues with anything specific. And for me, I, like Lisa said, it's protein first, always protein. That is my first thing that I will eat on my plate. And I also pair it with like healthy carbs, like vegetables and fruit. And so it's always like, I think my meals are pretty balanced. I make sure I got my protein, I got my vegetables, and or fruit, depending on what I'm having. I don't like, I don't really restrict anything, but I just try to keep my stuff healthy, and I don't, have junk food and stuff. Although we do have a 13-year-old, so there is junk food in the house. But I find the things that will work for me. So like, I love dark chocolate. So for me, I make sure I have like the monk fruit or the stevia sweetened dark chocolates, things that are that I feel are okay to have once in a while. So because I feel like if I restrict myself or and all of because a lot of us that end up with weight loss surgery, we had years and years of dieting, trying all the fads, going up and down, losing weight, gaining it back, gaining more weight back, and the thing that was my downfall, I think, is whenever I really restricted myself on something, because then I'm so stubborn that I'm like, you can't tell me not to have that. I want to have that, So I find healthier versions of those things. So I still feel like I'm having what I want, but it's better for my body now than what I was eating, prior. So
how often do you have them?
Like dark chocolate or a treat or something?
Mm-hmm.
I don't know. A few times a week or so, maybe.
Yeah. That's usually what I recommend do people is that like you definitely can have some treats, like enjoy life, enjoy food. Just don't make it like you have to enjoy something that is not necessarily on your healthy food list. I just wouldn't make that try not to have that every day in your life.
Yeah. Right. So like we had vacation recently, and while we're on vacation, I would have a little bit of this or a little bit of that, so that I could taste it, and like, yep, I had that. That was good enough, And so I don't think being super restrictive is a good thing, but do be mindful of it, and it's not something you need to have every day, and not something you need to have after every single meal,
Yeah.
So.
I would say 80-20. So if I'm 80 to 90% good, then 10% of the time I have fun. And it's, again, very simplistic, but like something that we do commonly in the house is that we have fun Fridays, because I agree that like most of us have sat in a seat where we have had restriction. Some of us maybe from a very young age. I do think that morphs into something else that's unhealthy. But once you start to understand the mindfulness, you understand what's going to make your body feel the best, then all foods on the table, it no longer has the same weight, right, as it once was. With 3 kids in the house, we have all kinds of treats. It's really odd, but my kids prefer produce. I am not joking. I post this all the time. We cut up sweet peppers, cucumbers, celery, carrots, like all kinds of produce, fruits, melon. And my best friend, she actually teases me about this all the time. I'll throw it out there. I'll put some popcorn out there. I'll also add some cookies and other things. Why is most of their plate produce? Because all foods are on the table. We're not going to emotionalize or like add emotional like value to this. It's just food, right? So fortunately for us, I think that we usually make healthier choices because it just tastes better and it fuels our body better. And there are certain things that I found that I don't really want anymore. So something that I used to love was s'mores, and we do s'mores nights, but I had a s'more and a half or something one summer, and I was so sick, and I was like, weird, because it was not, but it was so much sugar at one time that my body was like, what did you just do to us? So like, I don't reach for s'mores like that anymore. I might split a s'more or with my kids or something like that. So I'm not completely restricting from it, but there's certain things where I'm like, I do have a rule though, that like, I don't like diet food.
Yeah.
Like, anti-diet food, mostly because what you find in ingredients with diet food is that they add crap in there that you shouldn't be putting into your body. So I do like whole nutrition and whole food. And even if that means that like it's real ice cream because there's 3 ingredients and I have, a fourth of a cup, I prefer that over like a gallon of diet ice cream. So I don't care for things that have excess flavors or weird flavors, which is something I might have done, when I was heavier. I might add a sweetener or something to my water. Now I just have water with lemon and cucumber, and that's wonderful. It's refreshing, right? Like, so I find that my palate has changed. I don't know if it's more sophisticated now or
You're classier. This is classy surgery.
Yeah, it's a little bit more like I don't like fake, I don't like things that are artificial or whatever. Like my body just doesn't like it, so I don't know if that helps, but like, yeah, I think I was very fortunate as well. Like I don't feel like there's food that I can't eat or can't tolerate. I have no food aversions at all. It's more of a preference for certain kinds of things now, that it's like I just want a big veggie omelet, like that's just something that I crave now versus in the past I might want like pancakes and bacon or something. Neither of these things are bad. I just know that my body will do better when I, add veggies to my eggs, and I'll have a better workout and I'll sleep better and I'll feel better, throughout the day.
Yeah, absolutely. So I got my last question here. Before I do my last question, any other kind of experience stuff you'd love to share with people that are out there kind of interested in weight loss surgery, or people that have had weight loss surgery who are looking to get the most out of it?
I say one of the things that I felt helped me be successful is having the right mindset when I did this journey, and that having this surgery was a tool and just one of the many tools I was going to need, but I was the one that had to put in the work and do it. And so like frequently when I talk to people about how because I end up losing like 160 pounds. So it's a big difference, very noticeable.
Yeah.
And if I talk to anybody about it, I said, I was honest because I didn't feel like I wanted to contribute to the shame that a lot of people have around weight loss surgery. So I'm like, I had weight loss surgery, tell them the type I had. And then I worked my butt off. I put in the work to do it because it was just one of my many tools. And I think that helped me be successful because I think a lot of people think of it as this magic pill or just that it's going to fix everything. But really, you have to put the work in and work your butt off to be successful with it. And I think anybody that's thinking about it should do it because I literally feel like it saved my life.
Yeah.
I mean, I think, once again, I think mindset is everything. I think one of the first questions I asked Dr. B was, okay, what is who are the people who are the most successful at this and what does their profile look like? And then also, who are the people who don't do so good at this? I wanted to know what that distinction was when I came into it. And when you said those 3 things where it's like they're moving, they're prioritizing their health, they're prioritizing what nutrients they put into their body, they have a good cheerleading squad around them of support, and they're like, checking in with us like long term, even past, that 2-year mark, they're going to be the most successful. So I think I just imprinted that in my brain, somewhere and said, okay, so that's my plan then, for the next however long. The second part of that was removing timelines. So one thing that we really, really love to do is, put timelines or benchmarks or, on the calendar and say, I have to lose 6 pounds or 20 pounds or whatever it is by this date. I removed all of that from day 1 of surgery because I said, this is just how we live now. And what it looks like is that there is no time frame in which I need to achieve this by. So 3.5 years out, I don't really need to think about weight loss anymore, but what does it look like for the next 3 years, right? What does it look like for the next 6 years? What does it look like for the next 10 years, right? For me to be able to maintain health, and to continue to, proceed in health. Because for me, it was really never about thinness. It was always about my health because I came in so unhealthy. There's so many things that I was like, help, like I need to be in health. So even now, when I go through hard times, there was a time in my life that I can say I didn't have my health. And to be able to say that I have it now is like everything, right? It means everything. So everything is possible now because I have it.
Well, I think that in performance psychology, actually, the whole discipline of performance psychology, that's a huge element of process driven as opposed to outcomes driven, because you can control your you can put the work in and control it and have the variables that you have the most control over the process. You don't really have control over the outcomes. But when you have a good process, those add up to good outcomes. So no, that's really cool. So what would you ladies, what would you say to someone who's interested, on the fence about weight loss surgery?
I would say, first make sure you have a good support system. So like my husband was like phenomenal, supported me every way. My friends were supportive, so make sure you have that good support system because it helps get you through, because there can be tough times. I mean, because this is a major change. And like I said, make sure to have the right mindset when you're going into this, that you're going to need to put in some work for this, because this is a change. And like Lisa said, I never had a goal weight. I never went in with any like rules on what I wanted to do or reach. I went into I needed to be healthy, because just with the fibro and it being over 300 pounds at the start of this, it just moving throughout my day, it just taking care of my everyday things was incredibly difficult. So I just be healthier. So that was my mindset going in. I want to be healthier. I didn't care about the number on the scale. I just wanted to be able to move easier and be healthier and keep up with my family. So I never put any number goals on myself or anything like that. I just worked at it till I felt like I was where I wanted to be. And I'm like, okay, this is good. I'm good here. So, don't put any rules on yourself. Try to have a good support system and have the right mindset before you go into it.
I would challenge just why you feel hesitant. Something that I had to sort of do some internal work on, and I wasn't as hesitant probably as maybe a lot of people were. I felt pretty sold, but like, of course you're going to have hesitations. You leave the office, you're going to go home, you're going to talk to your spouse or partner, or your friends, whoever, and maybe they're going to put doubt, in your minds. For me, this is a little bit silly, but I was like, is my hesitation because I'm just going to eat less for the rest of my life? And once I've identified, right, this core fear of smaller portions for the rest of my life, and then I finally said, I'm okay with this, that because there wasn't anything else I could think of, right, except for this one barrier where, I was going to eat less for the rest of my life. And I got through that, and it was a millisecond, right? Like it took no time at all for me to make that decision. Like, it was a game changer for me, because I then removed this barrier and this stigma that I felt like trained over the course of a lifetime, living in our country, to believe that more food equals good, right?
Yeah.
It isn't for us, actually. We know that it isn't, and it's kind of wasteful, actually. So if you really want to get into it. But yeah, so I would say just kind of figure out what that core hesitation is, and deal with it and be honest with yourself, right? Do you want to stay wherever you are? Because we're not coming to bariatric surgery as a first option. Usually we've been through multiple things, diets, maybe we've had a health scare. And this is for some people kind of their last stop to finding out what that health is. I want to challenge that by itself and say, this is not as drastic. Thankfully, like bariatric surgery has evolved so much that it's not really what it was, right? It's scientifically like the least invasive thing that you can do, and it's going to increase your span and your lifetime, right? Rather than staying on that unhealthy body.
I think you're right, though, too, Lisa. I think some people, and I've seen this, will hesitate because they're really concerned about the surgery. And the risk is about the same as having your gallbladder out.
Better.
And it's better. It's, especially with our surgical experience, right, Brandon? I mean, complication risk of 1% or less. That's way ahead of national and international averages. But it's still something where people have to say, there's a real but small risk, and that will be enough for people to kind of keep, in the body that they've currently got. And so, but anyway.
Yeah, ladies, thank you so much for joining us. You guys have been wonderful. And just a great experience that you've shared, and I really appreciate you guys being honest and candid with the ups and the downs, and I really hope that anyone out there that's kind of looking at this, kind of thinking about who's struggling, you're not alone. Like that's the understatement of like the decade right there. There are 142 million people in this country with obesity. 142 million people. That is the population of Russia. Like, it is such a big issue, and we're not tackling it very well. And thankfully, we have good tools. And these surgery is the best tool that we have. In the right hands, it's very safe. You want to have a good follow-up program to get the most out of it. But man, it can change your life. It's so cool. So if you're out there kind of thinking about, doing this stuff, please reach out. We love helping take care of people. I mean, this is what gets us out of the bed every day, because there's nothing better than this. So I feel like I tell people this all the time. I feel like I win the Super Bowl like every week. Seeing people years out, you're just like, oh man, like this is why you became a doctor, because you wanted to see people's lives change. You wanted to see them have healthier, longer lives. And I mean, it's not just that. I think it's even for the parents wise, the example that you're setting for your children now, we're starting to break that generational. I mean, honestly, like, and that's just the way it was. Like 50, 80 years ago, our approach and our lives were so different that that wasn't really probably the appropriate way to think about stuff. We did this problem really crept up on us fast. And so we have to pivot. We have to change. I think the way we talk to our children about food, with the relationships we want to start building and modeling with our children with food, are really, really important for really breaking this cycle of worsening obesity every year. So, there's so many monologues I can get into, but anyway,
let's have another podcast.
So
I appreciate everyone who has tuned in, and ladies, thank you so much for coming. It's been great. So,
thanks for having us.
Yeah, thanks for asking. I'm always happy to talk about this.
Yep. Well, keep doing what you're doing. I'm loving the rhythm of both of you. So congratulations. He says he feels like he won the Super Bowl. I feel like I just won my team. I watched my team win the Super Bowl. Get to live vicariously in the stands. So, all right. It's good stuff.
Cool. Well, thanks again, everybody, for tuning in. And thank you, Lisa and Tina, for coming. And if you're interested, we're here for you. EVIVAMD.com. So.
Got it. Thank you, ladies. Great weekend. Bye-bye.
Bye,
everybody.
Bye.
Bye.